Hello. I'm gonna wait a few minutes till a few more people come on. We're just gonna chit chat about surgery. I think today I'm gonna talk about the first day of surgery. So, hello everyone. We're just gonna be talking about, we can talk about whatever, honestly, but the main focus is gonna be like the first day of surgery, what it will look like. I'm a little late, so I don't know. I think I'm shadow banned, so I don't know if Instagram is like notifying everybody that I'm on live right now. But it's not. If not, it's just gonna be me and you. Yep, it's Diamond. It's just gonna be us. So we'll give it a few more minutes. But do you have any questions? My name is Nurseciarachanelle. I'm a recovery nurse. Hey Bree. Hey Moneybag Maya. Okay. I think I'm shadow banned. I don't know what's going on. But today we're just gonna talk about what surgery looks like. Any questions that you all might have. This is an interactive live. You all talk to me, I talk to y'all back. You can ask questions in the comments. Most of the time people will answer them for you. If I am like talking, somebody will respond back to the comments, but we're just chit-chatting. The topic today is what surgery will look like. I got a new puppy, so 1 second. Let me go get him because I don't want him to like be whining in the background. 1 second. Come on. Thank you. I have tape ins. I was going to talk about that as well. Hair that we should wear for surgery. Because most people, you think braids so you don't have to do your hair. But don't get long braids. Because long braids kind of get in the way. Like if they all the way long down your back, they get heavy. One time, one girl just started cutting her braids out of her head. So I'm thinking if you wear wigs, maybe a wig. Or maybe like 6 braids, not like box braids, but like 6 like straight backs like into a bun, probably, because if you're getting a BBL, then you're gonna be laying on your stomach. But those long braids, don't do it. Get some short braids. Anything you all want to talk about before I start? I have bra length dreads. What should I do with them? Try to get them done in like a updo if you can, or put them. I just know that one time I had a girl, she had box braids and she put them at the top of her head and they were so heavy. But if you have dreads, you probably had them for a while. So just try to put them up. This is my new puppy. His name is Buddy. He was crying in the background. All right, first day of surgery. Let's talk about it. So, you typically they give you a surgery time the day before surgery. So when you get here, you'll go to pre-op. You sign all your paperwork. Be prepared to be at pre-op for a few hours. Some people get you in and out. Sometimes if you're going to a surgery center, I can't even say if you're going to a surgery center. The doctors sometimes come see you in between surgeries for pre-op. So be prepared to be there for a while. Eat before you go. Probably have your charger and bring like a light jacket or something, because sometimes it's cold in there. So be prepared to be at pre-op for a long time. Eat before you go. Then afterwards, I don't know that they'll do your pregnancy and drug screen there. Sometimes they do it on pre-op. Sometimes they do it the day before surgery. I personally think that they should do it on pre-op, because don't have me coming to surgery the day of and then now I'm canceled. Anyways, So that's pre-op. The day of surgery, they give you the time of surgery the day before on pre-op, probably like around 5, after 5 p.m. or 7 p.m. they'll give you a time. So hey everybody that's coming in, we're talking about the first day of surgery, and then if you have any questions, just drop them down below and I'll answer them. So then the day of surgery, you go to surgery. So when you go to surgery, wear a robe and probably like a nightgown underneath it and just some slippers. Bring your compression socks, but most likely they'll provide you compression socks. So you want to wear a robe, slippers, bring your charger, but don't bring anything else. You don't have to bring your wallet, your purse. You don't have to bring any of that to surgery. Some people bring their ID. That's optional. You should ask them for pre-op. So you get to surgery. They might make you do a pregnancy test. You're waiting around. You'll see the doctor get marked up. Then you'll see the anesthesiologist. I am just going by what people have told me. I haven't been to surgery yet, but this is just what people have told me. Everywhere it might be a little different. And then you go to surgery. They walk you back to the OR. So typically, if you're booked with me, I'll say, hey, let me know when you're headed back to the OR, because it could be a few hours before you actually get back to the OR. Once, like, they give you a surgery time, but it could be a few hours before your surgery starts. So I would say, all in all, you'll be at the surgery center for like 5 to 6 hours. And then you get the surgery done. They'll say a few little things. I know Dr. Nassif, they say his anesthesiologist prays, so that's good too. And then you wake up. You wake up in recovery. Some people say they wake up wheeling out when they're getting wheeled out. But then they wheel you out to me. If you're booking with me, I hope everybody on this live is booking with me. They wheel you out to me. You get in the back car. You're probably screaming in pain, or you probably don't have a lot of pain. Some people just say their stomach burns a lot, or some people might say their butt is like really, really tight. So just prepare to be in pain. It's not going to be anything unbearable, but just prepare to be in pain. We get you back to the hotel. Hopefully you have your meds already. Some doctors give you your prescriptions the day before, so you can go get your medicine the day before. But then if not, then either I will leave to go get your meds, or somebody else that you brought with you, your companion, I would probably send them to go get your meds so I can stay there with you. The first couple of hours, you're going to be up and down. If you got a BBL, I'm talking to people who've had BBLs, because that's the most common procedure that I get. You're going to be up and down for about an hour and a half until those pain medicines start to kick in, and then until you're able to take a nap. I don't know what it is about the nap, but when most people take a nap, they wake up feeling so much better. It's just getting comfortable enough to take the nap, because you can't lay on your butt, or you can't lay on your sides. You're in so much pain. So that's the first day. If you get an IV, the IV will be administered to you. We have a lot of vitamins in the IV. We also offer Toradol, which is a pain medication, and iron. So you should want to get those too. I definitely recommend that. And then it's just like a booster, like, child, my puppy done ran off, but I don't got time for that right now. The IV just helps you catch up, because you're going to be draining a lot, so that's common. And that's pretty much the first day. You'll stay in your garment. It's going to be bloody and wet and icky. That's fine. Everybody goes through that. You'll stay in your garment until the next day. Did that make sense? I'm sorry, I was just rambling off, but when I get in my zone, y'all, I just start talking. Okay, hey to everybody that's came on. I don't know if Instagram shadow banned me or not, but we just gonna rock with the 7 people that's here. That's fine. I appreciate all of you. My name is nurseciarachanelle. I run Recovery Lux. I am a registered nurse. I've been a nurse for about 6-7 years now, and I've experienced in the ICU. So I do recovery nursing down here. If you have any questions, please drop them in the comments below, and I'll get to your questions. But this is an interactive live. I talk to y'all, you all talk to me back. So we covered hair. No long braids. I mean, you can get them, but from what I've seen, they just very difficult. So just get something that's easy to manage. And then we talked about the first day of surgery. She said, I'm also wondering how comfy I will be laying on my breast after BBL. I've only had my implants 10 months. I doubt that your implants would pop that soon or even at all. But I'm not sure about the comfortability. How are your boobs now? Are they still sore? Have they healed? That's really kind of, unless you want to sit on your boppy pillow. But from what I've seen, when people sit on their boppy pillow like the next day, I be seeing them in the groups talking about how they fat died or the projection went away. So maybe we can like put a pillow up underneath your stomach so that you're kind of elevated and your boobs are not, you're not laying directly on your boobs. We probably could do that. You know, I'm gonna think of a way to get y'all comfortable. Hey, Dejanay. How many days do you recommend nursing care? I recommend at least 2 days. 3 days if you want to go all out, which I definitely recommend 3 days. But 3 days can be a little pricey. So at least 2 days of care. Hey, big boy mommy. Rubiana Solana said, hey love, what do you do if the drugstore doesn't have the prescription meds you need after surgery? You just wait till the next day. We have Tylenol that like the doctors say get Tylenol muscle relaxer and Tylenol arthritis. If you're booking with me, we also offer IV therapy, and we have IV Toradol, which is a very strong like aspirin muscle relaxer. No, Toradol is not a muscle relaxer, it's an NSAID, I'm sorry, but it's a pain medication that we can offer you. It's $60 extra. But if the pharmacy is ran out of meds, it's really not much we can do but give you Tylenols. CBD gummies helps too. CBD gummies works wonders. Now, don't get them with THC if you don't smoke weed, because you don't want to be hallucinating or having any other reactions. But CBD gummies help too. So if your surgery center gives you meds the day of surgery, try to get some CBD gummies. Those help. Booking with you when I have my surgery with New Life. Guys, I recently just stopped taking patients from New Life. New Life is with 305, and so before it was like the whole 305, anybody that's affiliated with them. But then I would have people from New Life. But it's like every time I have someone from these facilities, it's some sort of complication. Like even Vixen. Vixen is a part of 305 too. And I'm like, let me just try them out, you know, since they're a different surgery center. But they still, it's the runaround, like cancellations. It's crazy. I prefer not to deal with those centers, only because I don't really have the staff to accommodate you, and I don't want to feel like you know, not wasted your money, but basically if I can't care for you because they didn't switch your dates 50 million times, or they cancel you, or something crazy that they allegedly do, I don't want you to feel like you just wasted, because the deposit is non-refundable, you know. And then the complications that I run into with these centers is they will switch your date to either bump you up or bump you back, and then I'm booked. So if I'm booked, I can't care for you. Like, I'll be booked out the whole week. So if your slot is your slot, if I can't care for you, that's kind of messed up. And then you scrambling trying to find care. So to prevent all of that, I just be like, no, I don't deal with them. I'm sorry. I don't know. And then every time I try to like deal with them, something happens. Something always happens. I'm like, see, this is why. I was just dealing with a person from Vixen, and I mean, it was something very minor. They just were like, in this scenario, they was like, you have to have your surgery like 2 days ahead of time, or your labs will expire and you'll have to do all your labs all over again. And it's like, why would you wait until she got down here to tell her that? Like, or, you know, like, it just be little things like that. So it's too complicated. It gives me a headache, honestly. But that's why. If y'all wondering why I don't deal with them, it's because it's too much of a headache and it's so organized for me. I can't run my business properly and adequately when I deal with unorganized centers. But thank you for considering me. If you go somewhere else, I'll take care of you. Rubiana, you're gonna book me this week. Thank you, girl. Do you offer B12 is included in the IV, in the post-op IV drip. On my booking page, it'll have a list of all the ingredients that's included in the IV drip. Hey, La Chicabella. Okay, back to the boobs. She said they feel tender sometimes, but they are fully healed. I don't want to sit on. Yeah, don't sit on your butt. What we'll do, Bree, because Bree's booked with me, and I can't wait to see her because that's my sister. Some of these people, I don't even know y'all, but I just be, y'all be family before y'all even get here. What we're gonna do for her, since she got boobs, what I've just thought about in my mind, she said she just got her boobs done 10 months ago and she's coming down for a BBL. I'm gonna put a pillow, maybe 2 pillows up underneath her abdomen. That way she's sort of raised up and not laying directly on her boobs. Hey everybody that's joined in. Can I say the names for what? Yeah, like I don't want to bash them. I don't like bashing anybody, and I'm not bashing them. That's just the reality when I have clients from these centers, and it's happened so much to where I had to put a stop to it. You know, it wasn't just like a 1 or 2 time thing. It was just like so common all the time, and it was just like at the end of the day, I'm gonna be missing out on money. They're gonna be missing out on care. It's just not fair. And then those centers, they don't even be caring. They don't even take that into consideration, like at all. It's crazy. Can I say the names for what? Oh, the surgery centers I'm talking about. 305 and anybody that's under the umbrella of them. So New Life is under them, and I believe Vixen is under them. Allegedly, they have high cancellation rates. So I don't got time to be going to court because they're going to try to sue me for defamation, but whatever. Allegedly, that's what happens. But I had a few Vixen clients. I mean, I can deal with Vixen for now. For now, I haven't wrote Vixen off. New Life, 305, it's just, But Vixen, I've had a few clients from them. And the other day, that's when they did that crazy stuff. So that was strike 1 with Vixen. We're going to give them a few chances. Only because Dr. Triggs is fine. Any other questions? Also, who's left on here? The Plugs, Baby Mama, and Diamond. What are you all getting? Are you all getting BBL or tummy tucks? Girl, that man is fine, okay? That's the only reason why I'm lying. That's not the only reason, but I do want to give them a chance. And then, honestly, he's like a black African American man too, so I don't want to write that off. You know, we got to stick with our people. Tummy Tuck and BBL combo. From who? BBL. I'd be so excited. You say you want me, but I'm booked. Which date? I'd be so excited for y'all. Also, bring your vitamins too. If you've been taking iron and stuff, I know they say stop taking them a week or 2 weeks before surgery, but you want to bring them with you to Miami so you can start taking them. BBL arm lipo. Trix says I don't have enough fat on my stomach, so he's recommending inner thigh lipo. Yeah, I was gonna say before I got to the end of the paragraph, I was gonna say try inner thigh lipo too. Dr. Surlock. Okay, I've had a client from Dr. Surlock. I didn't have it. He did good. It's so many doctors. That's why I like learning like new doctors. I'm booked with Dr. Fisher. They actually just sent me an email and said they had some June dates. I mean, July 5th surgery day. Oh, see, my birthday is July 6th. So that's why I'm booked that day. Or blocked that day off. Sorry. I wonder, I can't even recommend any nurses because I don't really directly work with anybody, so I would hate for anything to happen and they'd be like, oh, Ciara recommended me to these people. But I do know Stay RN is good. If you're looking for a registered nurse, Stay RN is good. There's a lot of them, but I don't know them to recommend. Does Dr. Serlock have a Facebook group? You're welcome. Does he have a Facebook group? Yeah, Stay RN, they're actual RNs. There's a lot of them, but I just don't want to, you know, say something and then you go there and then you have a bad experience. But I do know Stay RN is good because I was going to use Stay RN for my surgery. Oh, yes, 2 Facebook groups. I'm going to have to join onto there so I can promote myself. Do you have any more questions? And Brianna, I know we talk all the time, but do you have any questions? Any other questions? Because now you got me thinking of a hairdo style for you. No? No questions? What else we could talk about? Oh, Diamond, also, airport, you want to make sure you get wheelchair assistance too on your flight back. Oh, thank you. I gotta get in that group. Can you tell me? I'll have to look it up, but can you tell me the name of the group? I was thinking of updo, but I don't want my hair to be tight. Yeah. Or maybe we can do like a low bun. I'm talking about we can do. Maybe you can do like a low bun, like twist it around a little bit. Hey, Miss Poker. Okay. Or just leave. Okay, I'll DM you so you can DM me because I think my DMs are off. So I'll DM you first. But thank you. Hey, Miss Poker 4. We're just talking about day of surgery and hairstyles to wear and any questions that you might have. Can you fly out of Fort Lauderdale, or is it best to just go to Miami? You can fly out of Fort Lauderdale. There's a little bit further, so about an extra 30 to 45 minute drive, depending on traffic and depending on where you're coming from. It could be up to an hour, but honestly, everything is about 30 minutes down in Miami. Excuse me. I personally always fly out of Fort Lauderdale when I'm leaving because Miami's airport is so big. It's so huge. I've missed like 3 flights out of there. I feel like Fort Lauderdale is a little bit smaller, a little bit more convenient for you to maneuver around, especially just having surgery. And it's kind of cheaper sometimes too. Most of the time it's cheaper too. So I would say Fort Lauderdale if you can tolerate the drive up there, because it's not a short drive. Hold on, my puppy's crying again. I don't know what my son did. Rodney, did you put him in a cage? No, he can come out. Yeah, he can come out for now. My fault, y'all. Yes, Miami's airport is literally insane. So that's why I said get it wherever you, whichever airport you fly out of, get wheelchair assistance. But the airport is so big, I hate it. But sometimes it's more convenient. Don't come over here, please.
Mommy, where's the other drink? Did you drink it all?
It's in the car. It's okay, just get some water. Okay guys, I'm logging off. Thanks for coming in. Hey, is it Kashay Hampton? Hey. We were just chit-chatting about the day of surgery, what it would look like, and hairstyles to wear if you're getting cosmetic surgery. And any questions that you might have, you can ask them in the comment box. I think I'll make a reel about that too. No questions? Okay. I'm logging off now. Have a good night. Thank you all. If you haven't already, turned on the post notifications so you don't miss the next live. Bye.